whether we've done a pap smear or we've done the core testing with HPV, there are a couple of results we can get. Of course, the one we want is a negative result, meaning there are no abnormal cells that have been detected. But in some women or some young girls, we can get some early abnormal cells. And these we also classify into two. We talk about the low risk changes and also the high risk changes. Now, the high risk changes are the ones we get very concerned about, because these are the ones that have been shown over time, up to 10 years, that they can easily progress to cervical cancer. So once you have a result that shows you have abnormal cells, the good news is this is not equivalent to a diagnosis of cervical cancer. It just means you have abnormal cells on the cervix, which later on, if untreated, can easily progress to cervical cancer. So this is where we go ahead and we take a small tissue sample right on the cervix, what we call a biopsy, and we take it to the lab and we're able to analyze the extent of the abnormal changes. Most of the times we are able to catch these changes very early, and cure rate is 100%. However, if you delay within 5 to 10 years, it has been shown that these abnormal cells will later on progress to now what we call cervical cancer. And that is the third pillar where we want to target early treatment once the diagnosis of these precancerous changes or cancerous changes have been detected. If cervical cancer, just like many other cancers, is detected at a very early stage, even up to stage 1, it's very important to know that the cure rate is as close to 100%. Treating cervical cancer that is advanced is a very costly affair to the family and even to the government, because remember, most of these patients will end up in our referral facilities like Kenyatta Hospital. That hospital is funded through tax. It's not free. So at the end of the day, it's very expensive. So we want to prevent any woman from a late diagnosis. Now, let me go back a bit and talk about the signs and symptoms. It's very important to mention that even early cervical cancer will not present with symptoms. So do not wait until you have symptoms for you to come in for screening, because by the time you're having abnormal uterine bleeding, you're having pelvic pain, you're having a foul-smelling discharge that is coming through your vagina, that might indicate that your cancer is advanced. And most of the times you will develop these symptoms late, meaning we're talking about stage 2, stage 3, or even stage 4 cervical cancer, which is very hard to manage. So let's come in before any signs and symptoms are seen so that we can be able to detect the abnormal cells or the early stages of cancer, where we can be able to offer a very high rate of cure.